Good afternoon, and welcome to the Debriefing broadcast on the results of the 2011 Continuum of Care Grants Competition. My name is Oliva. I'm the Director of the Office of the Special Needs Assistance Programs, otherwise known as SNAPS, and I have two members of the SNAPS staff with me here today, Brian Fitzmaurice and April Mitchell. I get the easier lift today. Brian and April will review most of the content of this broadcast with you. As we go into the broadcast, I'd like to note that it would be helpful for you to have your debriefing materials in front of you as we walk through the broadcast. That would be the one-pager that breaks down your scores, as well as the text on common errors for the 2011 competition. At the end of today's presentation on the debriefing details for 2011, I'm going to wrap up with some additional information about 2012 and the implementation of HEARTH as we move forward. So let's review our agenda today. First, I'm going to hand it off to Brian, who's going to talk about sort of the 2011 big picture. We're going to go over the coverage maps for 2011, funding highlights, pro rata need, a slight refresher course on pro rata need, lessons learned in 2011, the Continuum of Care application and the project application, which is Exhibit 1 and Exhibit 2, details. Then we'll discuss special initiatives. Then I will wrap up with the 2012 update, and we'll talk about some resources that are going to be available to you as we move on through the course of the year. So with that, I'm going to turn it over to Brian, who's going to start the content for today's presentation.
Thank you, Ann. Hello, everyone. Good afternoon. As Ann indicated, first I'm going to go to my slide. Thank you. I will give an overview, the big picture of the 2011 competition, so everyone has a good general understanding, how we did and what we did. We'll start with some of the significant changes in 2011 from 2010. First, as indicated in the 2011 Continuum of Care NOFA, and in anticipation of the publication of the homeless definition final rule, all projects awarded in the 2011 COC competition will adhere to the new homeless definitions as published in the Federal Register on December 5th, 2011. The new homeless definitions went into effect January 4th, 2012, and are applicable to all projects, that's new and renewal, or in the order that we announced them, renewal and new, awarded funding in the 2011 competition. Next, COCs and project applicants were also required to complete the applicant profile information prior to gaining access to their respective applications. As a reminder, the applicant profile can be updated at any time during the year, not just during the competition periods, which we hope you will find very helpful. HUD strongly encourages all COCs and project applicants and grantees to update that information contained in the applicant profile as staff changes occur. This is to ensure that any HUD communications sent to the COC or project applicant are received in a timely manner, particularly communications that are time sensitive. Finally, in the big changes, 10 Continuum of Cares around the country were identified as extremely high need communities in 2011, and this was based on a couple of factors, actually 5 factors: foreclosure rate, the per capita rate of homelessness, unemployment rate, the ratio of unsheltered to sheltered homeless persons, and finally, the preliminary pro rata need, which we will talk about in just a few minutes. These communities were awarded 2 extra points, and again, there were 10 extremely high need communities. Okay, now let's talk about, to keep to our schedule, just to let you know, how we did in making announcements. The 2011 renewal awards were announced December 20th, 2011, and the new awards for 2011 were announced March 13th, 2012. And I'll give you an idea what was requested and what was rewarded in the 2011 competition. Just shy of 8,000 projects, that's 7,973 project applications were submitted into eSNAPS, our electronics application system. All of these had to be reviewed by HUD staff, and that constituted a request of more than $1.6 billion requested. HUD awarded $1.67 billion to 7,887 projects, out of which 733 were new projects in 2011. Only 9% of the total funding was awarded to those new projects, which of course means that 91% of the total funding went toward renewal projects. Okay, as Ann mentioned, we'll look at maps that will give you an idea throughout the country how the 2011 competition looked. So this first map represents funding nationwide. All of those areas in green were funded competitively. The areas in blue were awarded one-year funding for renewal projects, and the areas in fuchsia, which to me is just purple, applied for funding but did not receive any funds. Finally, those few areas that still remain in white that you can see on the map did not apply for funding. Okay, and now we will look at preliminary pro-rata need versus hold harmless need throughout the country, the funding status. This map shows the country by preliminary pro-rata need, which we refer to as PPRN, and hold harmless need, HHN status. Those areas in green are in PPRN, which is preliminary pro-rata need status, and the areas in orange are in hold harmless need status. Again, we'll go over what those terms mean in just a moment. And again, finally, those areas in white did not apply in 2011. So let's look at some of these remaining high-level highlights. Scoring. As you see the range there of the scoring, it is important to note the high score and the average score for 2011 were at least 1 point lower than what we saw in 2010. So in 2011, the high score was 90.25. In 2010, it was 91.5. The average score in 2011 was 74.22. In 2010, the average score was 75.42, the average score. This decrease, small but still a decrease, was likely due to Continuums not paying close attention and fully and accurately completing all the questions in Exhibit 1. As you know, every point counts, so please do not leave any questions incomplete or inaccurately responded to. We'll look at this a little bit further in the next slide. This chart, this pie chart, shows, as you can see, that at least 3/4 of the COCs scored above the funding line. The funding line was 65 points, so at least more than 3/4 scored above the funding line. Only one scored over 90 points, and that is the zero there. It was not a significant enough percentage to even show as 1%. The most significant change in 2011 occurred between the number of COCs that scored in the 80% range, which is that kind of orange color up there. It was 8% less. In other words, last year was 34% scoring in that range. As I mentioned in the prior slide, one of the main reasons for that slight decrease in scoring from 2010 to 2011 was in the narrative information responded to in Exhibit 1. The narratives provided by Continuums either did not fully address the question asked, or they were not adequately updated from the imported information from your 2010 Exhibit 1. What happens is if you bring it in from 2010 and don't check it over, it could contain information that is not fully still accurate. So you want to make sure when that is imported that it does reflect this current year's requirements. Okay, let's look at renewal funding. In 2011, HUD awarded 7,154 renewal projects compared to 6,741 renewal projects in 2010. The number of renewal projects increased this year by 413 from last year's competition. And new projects. In 2011, HUD awarded 733 new projects. This number includes new projects for those COCs in preliminary pro-rata need status, using funds remaining in their final pro-rata need. Again, we'll explain that more in a moment. New permanent housing bonus projects, and COCs that used the hold harmless need reallocation process to create new permanent supportive housing and HMIS projects. Note that while there were more new projects awarded in 2011, as you can see, the corresponding amount of money funding was less in 2011. What explains that is that in 2011, we did allow one-year terms for new projects that were not restricted to HMIS or reallocation projects. Therefore, there was more projects, but at a lesser term of 1 year, and thus the smaller amount of money. Okay, well, this chart will compare renewal funding to new funding. Each year, the amount of funds available for new projects decreases as the number of renewal requests increase, making the competition for new funds even more challenging and competitive. In 2011, HUD awarded $1.473 billion of the available $1.6 billion to renewal projects. The amount awarded to new projects was $201 million. With less funding available for new projects, COCs continued to take advantage of the hold harmless need reallocation process. COCs in hold harmless need status were able to either reduce or eliminate underperforming renewal projects or those that were found not to be needed anymore in order to create new permanent supportive housing or HMIS projects in their communities. We also saw an increase in the number of HMIS projects submitted as a result of the reallocation. To give you an idea what the reallocation resulted in for 2011, 39 new projects were created for a total of $5.5 million as a result of the reallocation process. The average amount for a newly created project through reallocation was $140,000. The largest single project in that category was $450,000 for an SHP permanent housing project, and the smallest amount was $5,000 for an HMIS expansion. So that is the range, and it was quite a range. Now we'll take a quick look at housing versus services that we funded. In 2011, 29% of funds were awarded supportive services, and 71% of funds were awarded for housing costs. HUD's emphasis on housing, as reflected in the Exhibit 1 point structure, is due to congressional priorities, as well as the fact that HUD is the only federal provider of permanent supportive housing, which explains the importance of targeting funds to housing. Okay, now we will take a quick overview on what we refer to the pro-rata need and hold harmless need designations or statuses. First, we'll look at preliminary pro-rata need, which we know as PPRN. Preliminary pro-rata need is the term used to describe the relative portion of national homeless assistance need assigned to a community or group of communities in HUD's COC competition. The PPRN amount is the expression of relative homeless assistance need in dollar terms for use in a COC competition and is based on the CDBG universe of jurisdictions. Each year, HUD publishes the PPRN for each jurisdiction. A continuum's PPRN is determined by adding the published PPRN amounts for each jurisdiction within the HUD-approved COC. In 2011, HUD used the same PPRN calculations that were used in 2010. Therefore, in 2011, there were no changes to the designation of metro cities, urban counties, and all other counties. In 2011, there were 4,133 metro cities, urban counties, and other counties that received a preliminary pro rata need dollar amount. Now we'll quickly look at hold harmless need, or what we call HHN. The HHN is calculated by every continuum during the registration process, which hopefully, as you know, precedes the actual application. The HHN is determined by information submitted on the grant inventory worksheets, which we call the GIWs, and is used to determine the COC's final pro rata need, here's another term, FPRN, for the 2011 competition. The HHN was calculated by summing up the annual renewal amounts, another acronym, ARA, very important to you all, for all SHP renewal grants expiring between January 1st, 2012 and December 31st, 2012. If there were no SHP renewals in the 2011 competition, in other words, expiring in 2012, that COC's HHN was $0. For 2011, Shelter Plus Care renewals are not included in the hold harmless need calculation. Both preliminary pro rata need and hold harmless need are established during the COC registration process. And it's a very important process for you to pay attention to. Okay, we'll finish up this discussion here with final pro rata need, how it compares, how preliminary and hold harmless need determine your final pro rata need. Final pro rata need, FPRN, is the higher of preliminary pro rata need or hold harmless pro rata need, or the amount of hold harmless merger process, which is another status. Preliminary pro rata need is when the final preliminary pro rata need, can be a tongue twister sometimes, is equal to your preliminary. So the majority, your need based on your preliminary need status based on your geography exceeds what your renewal amounts would be. Hold harmless need status is when the final preliminary pro rata need is equal to hold harmless need. In other words, your renewal needs, your annual renewal needs are greater than your preliminary pro rata need. The hold harmless merger process is available to merging continuums where at least one of which was in preliminary status and at least one of which was in hold harmless need status for 2011. The process prevents a loss of final pro rata need for merging COCs. So in other words, it incentivizes merging COCs to come together to be able to have economies of scale and function better coming together. And so when you don't lose out, it is that incentive to come in and merge. COCs receive the summation of the higher final pro rata need of each original continuum to calculate their 2011 final pro rata need. The determination of final pro rata need is used to make project selection decisions. For 2011, Shelter Plus Care renewals were not included in the calculation of final pro rata need. It should also be noted that new permanent housing bonus projects are funded separately from final pro rata need, utilizing funding set aside specifically for the permanent housing bonus category. Alrighty. I am going to now hand it over to April, who will go over the actual Exhibit 1 and Exhibit 2 process, what we found in 2011, and she will take it from here.
Thank you, Brian. As Brian said, that I'll be going through the Exhibit 1 and Exhibit 2 of the application, and then also I'll be talking through the special initiatives towards the end. As you guys know, HUD each year publishes a NOFA that announces our changes to our annual competition. Thank you, ma'am. Our applicants, we are expecting you all to read through our NOFA and also read through the general section that HUD produces. In addition to the NOFA, we also publish detailed instructions that are offered in e-snaps on the left-hand menu bar. Those instructions are thorough explanations of each question that we have in the application, and it's very important that each applicant read through them thoroughly. In addition to the detailed instructions, we also have our virtual help desk. Our virtual help desk answers all questions throughout the competition and also offers explanations and even talk-throughs so that you can accurately work through your application in the best time frame as possible. Questions that are not protected under the HUD Reform Act are not answered. During the Exhibit 1, COCs continue to lose credit on questions because they are not able to read through our guidance and our training, and they're losing lots of points based on very simple instructions that we're providing. As Brian mentioned, in 2010, you were able to import your data in 2011, you were able to import your data from 2010. By importing your data, you're able to easily refer to last year's competition answers. However, you're able to read through those answers, but we would like you to be able to update your information as much as possible and answer questions that are left blank, seeing that all questions and answers are not transferred over into the 2011 application. We had a very few changes for the Exhibit 1. Thank you, Brian. There were very few changes in the Exhibit 1 for 2011. Those changes that we did have included the applicant profile, and also with the applicant profile, COCs weren't able to access the application, the Exhibit 1 application, if they did not complete the applicant profile. The point in time for this year was required, and that's one change that will be made in 2012, where our point in time is going to be required every year. COCs were required to conduct a sheltered and unsheltered point in time count during the last 10 days of January 2011. The HIC and the PIT information was due in the HDX by May the 31st, 2011. So in the application, as you'll see in the NOFA, there are 5 different sections. The first section is the COC Housing Services and Structure, Homeless Needs and Data Collection, COC Strategic Plan, COC Performance, and emphasis on housing activities. The first part of the application is the COC Housing Services and Structures. The COC Housing and Structures and Services section made up a total of 14 points. As you can see, the average score for Part 1 was 12, indicating that most COCs did a very good job at accurately portraying your structure for the COC, including the board membership and private organizations, as well as individuals. In this section, we are actually looking at organizations that you've included into your application, and we're looking at more or less the 5 sections that the 5 groups that you put in. So we're looking more at quality of organizations versus quantity. Only groups that were actually involved in the COC-wide planning activities were to be listed, and those were the only ones that we scored on. In addition, this included the housing inventory count in the HDX, the point-in-time chart in the HDX, and as again, those were both due in the HDX by May 31st, 2011. The second part of our application is the homeless needs and data collection. As you can see, the average score of this section was 14. This section also shows that we are looking at quality of data to ensure the existence of functioning HMIS systems in the COC. This section is a little bit more of a quarter of our application. Part 2 continues to be dedicated to questions towards the COC HMIS. One of HUD's objectives is to ensure that all COCs have COC-wide HMIS participation in both HUD-funded and non-HUD-funded program service providers. Many COCs continue to struggle with this section only due to the COCs not being able to show us what they're actually working with in terms of increasing the beds or showing us their data in HMIS. It is expected that COC should have a bed coverage of at least 86% for each housing type within the COC, excluding those beds designated for victims of domestic violence. Also in part 2, we're looking at point-in-time counts. As I stated before, our point-in-time counts are required every 2 years, and 2000 was a required year for the count. Our annual counts, we're strongly encouraging our COCs to do counts every year as your funding allows. As you know, beginning with the calendar year 2012, shelter counts will be required annually. If your COC was not able to complete your count within the last 10 days of January 2011, you were to receive a request from our office, and if you did receive that request, then you could complete and submit your request to us at a later time. COCs can request a waiver by contacting Michael Ronhouse. COCs were asked to describe the methods used to collect and calculate sheltered and unsheltered population data, including information on subpopulations. COCs were expected to use methodologies consistent with the point-in-time guidelines that we provide in the Exhibit 1 detailed instructions and also on the Homeless Resource Exchange, the HRE is what we call it. Two of the guidelines that we recommend is listed on the bottom 2 bullet points: a guide for counting unsheltered people and a guide for counting sheltered people. COCs were required in this section to compare the most recent point-in-time count to the previous one. Within the application, you were to indicate whether there was an increase, a decrease, or no change. You were also required to describe the factors that may have resulted in an increase, decrease, or no change. And the most common area in our application for this section is that some COCs were not able to indicate to us whether there was an increase, decrease, or no change. If they did indicate the increase, decrease, or no change, they sometimes were not able to explain the reason why adequately. So we'll move on to part 3, which is the homeless needs and data collection section. As you can see, the average score is 17 out of 22 points here. COCs were to look at their existence and alignment with and performance-based for 10-year strategy for ending homelessness that establishes specific action steps to achieve 5 objectives indicated in the NOFA. The COC's progress in working with the appropriate local government entity to describe and implement discharge planning policies is one of the points that we recommend in this section. Within this section, we're also looking at how well applicants coordinated with their HPRP, their NSP, HUD, VASH, and any other ARRA programs, and provide information on educational assurances and to demonstrate leveraging of funds within the COC and other resources. One note is that in 2011, the leveraging score was calculated on eligible new requests only. COCs were asked to provide 2 narrative responses describing the short-term steps and long-term steps within the COC. COCs were expected to provide narratives that include specific steps to meeting goals, They were also expected to show a cumulative increase for each benchmark through objectives 1 through 4, and a cumulative decrease in objective 5. Common areas were included in that last bullet where COCs were expected to show a cumulative increase. There were times in applications where there would not be an increase, or there wouldn't be a decrease, so the numbers would stay the same, and as well as with objective 5. Discharge planning is another one of our large sections within the COC applications, as you guys know. And we ask that to the maximum extent practicable, continuums of care should demonstrate their effort in coordinating with and assisting with state and local discharge planning efforts. We're looking to see if COCs actually have a protocol in place or are following state mandates. We're looking at the systems of foster care, health care, mental health, and corrections. Within the discharge planning section, we looked at who are your stakeholders, where you're discharging your homeless individuals, and indicate to HUD that you are not discharging to the streets, shelters, or homeless McKinney-Vento programs. In section 3, we're also looking at your strategic planning with coordination of HPRP funds, other HUD managed ARRA programs, HUD VASH, NSP, educational assurances, veteran homelessness, and youth homelessness. With regards to the educational assurances, COCs were to indicate if they already had established protocols in place that require homeless assistance providers to ensure all children in homeless assistance programs are enrolled in school and connected to appropriate services within the community. COCs were then asked to describe how they describe their established policies. They were also asked to describe their efforts to collaborate with local educational agencies, and also to describe how the COC will consider education needs of children in homeless families. We'll move on to part 4. As you can see, the average score is 21 out of 32 points in part 4. COC performance was another section that carried a large proportion of our points. Section 5 of the application has the largest section because we want to understand how COCs are performing and within their renewal projects, as well as their COC-wide activities to reduce homelessness. COCs were to report their progress towards reducing homelessness by increasing permanent housing beds for chronic homeless, decreasing the number of homeless families, and performance in the COC-funded renewal Exhibit 2 applications. COC achievements in this section were to increase chronic homeless beds, retain permanent housing, obtain permanent housing, increase employment and income, and decrease homeless families. COCs that did not have transitional activities in this section were not penalized for objectives 2, 3, 4. COC chronic homeless progress. We were looking to see the number of persons if they decreased. We were looking to see if the number of beds increased. With COC housing performance, our national averages and what we deem to be successful for permanent housing is 77%, transitional housing 65%, and we're looking with the COC enrollment in mainstream programs and employment information to see if applicants were able to have their participants meet the 20% goal. In terms of housing emphasis, only new eligible projects requests were included in the calculation. Points were awarded based on a relationship with funds requested for housing activities and funds requested for supportive services activities among the approved budgets for eligible new project requests. COCs were not required to have 100% housing activities to receive the full 6 points. COCs that did not submit any new project requests received 0 points for this section. However, this did not impact their eligibility for renewal project requests. And lastly, for part 5, The average score for this section was 4 out of 6 points. This section only applied to COCs that submitted new project applications. And next, we'll move on to our project applications, in which we call Exhibit 2s. Again, changes that are made are within our NOFA, and we publish that annually. Project applicants are expected to read the NOFA, as stated before, read our COC NOFA in the general section, read the Exhibit 2 instructions that are located in eSnaps on the left-hand menu bar, in addition to our HRE, the training modules, and the FAQs, or the FAQs that we publish in the HRE. Eligibility and threshold. The next slides will address the eligibility and threshold review, discuss the educational assurances and new homeless definition that went into effect in FY 2011 projects that were awarded. We also talk about hold homeless need reallocation, and lastly, we'll address the grant inventory worksheets for renewal projects and application budgets. Project applicants should keep in mind that the SF424 is to be completed by the applicant and not the project sponsor. The project sponsor cannot sign the authorized documentation on the SF424. The authorized representative is the individual who is able to enter into contracts with HUD on behalf of the applicant. Additionally, projects were asked to upload numerous documents into the FS424 or into the Exhibit 2 application. Some were required as a conditional, and some were required. The documents that were required to complete in the application include the HUD 2880, the applicant receipt disclosure and update report, the Complan cert, documentation on the nonprofit status if applicable. If documents that are needed to attach prior to grant agreement are the code of conduct, the drug-free workplace, survey of equal opportunity, and the disclosure of lobbying form if applicable. Callbacks were also issued on projects that did not have the required documentation. Applicants were expected to meet eligibility requirements for the specific program as described in the COC NOFA and provide evidence of eligibility and capacity. Applicants for Shelter Plus Care SRA were required to provide project locations at the time of application. To be considered for the rural selection priority, new projects had to serve 100% rural counties or their equivalent. Applicants for renewal projects were expected to meet project eligibility, capacity, timeliness, and the expenditure of funds and performance standards identified in the COC NOFA or were otherwise not considered for renewal funding. Per the FY 2011 NOFA, renewal projects that passed threshold were awarded with 1 year of renewal funding. In order to get ready for HARTH implementation, similar to last year, applicants with projects serving families were required to demonstrate consistency with educational subtitle, McKinley-Vento, and other laws related to the provision of services for homeless families. Applicants were required to demonstrate programs providing housing or services to families, have designated a staff to ensure that children are enrolled in schools and connected to appropriate community services, such as Head Start, Part C of the Individuals with Disability Education Act, and the McKinley-Vento Education Services. Projects included in the COC's HHN reallocation process were expected to reflect the appropriate budget amounts in the application. Budget amounts were often inconsistent with the amounts identified in the COC's Exhibit 1 application. If applicants completed the reallocation incorrectly, the amount of requested funding for the new project may have been reduced. With our Exhibit 2 projects, renewal budgets were expected to match the HUD-approved 2011 GIWs. SHP renewals that were requested more of their ARA, which is their annual renewal amount, were reduced accordingly, and Shelter Plus Care renewal projects that requested more units than under their grant agreement were also reduced accordingly. Now we'll move on to our special initiatives for 2011. In an effort to continue to achieve greater geographic diversity, selection criteria were given to projects proposing to serve 100% rural areas. For calendar year 2011, our slide actually says FY 2012, but it's really calendar year 2011. Awarded permanent housing bonus projects may only serve homeless disabled families, chronically homeless individuals, chronically homeless families, and safe havens did not qualify for the permanent housing bonus projects. For our rural selection priority, HUD's FY 2011 selection priorities provided preference up to $10 million to applicants requesting new projects within their FPRN, proposing to serve 100% rural counties. To be eligible, an applicant was required to propose serving 100% rural counties. This did not include their PH bonus projects, and these are not funded out of their FPRN. HUD published a list of counties defined as rural in the FY 2011 COC competition in the Appendix A of 2011 COC NOFA. In the publishing, there were 2,310 counties defined as rural for the competition. In addition, the project funds being requested must have been within the COC's pro rata need again. Permanent housing bonus projects and reallocated projects were selected separately. So a summary of our selection priority. Out of those that applied, 123 new project requests were proposed serving only rural counties. 60 projects were awarded under the rural selection criteria. 41 projects were awarded under the regular selection priority, and 2 projects were awarded as a result of COCs using the HHN reallocation process. $18.3 million in the new project request proposed to serve exclusively rural areas. A total amount of the new project funding awarded to projects exclusively serving rural counties were more than $15.7 million. $9.9 million were awarded under the rural selection priority. $5.7 million was exclusively awarded to projects that exclusively serve rural areas under the regular selection rules. Now I'll turn the rest of the presentation over to Ann.
Thank you so much,
Thank you.
April and Brian. That's a lot of information for folks to digest and understand. So again, this presentation will be posted up on the HUD website for your review at a later date if you need to go back and get some additional details on some of the material that we presented today. I'm going to actually deviate a little bit from what the rest of the presentation has been about and talk to you about what we're going to do as we move forward for FY 2012 and the implementation of the Hearth Act regulations. First, I want to talk a little bit about how important it is for some of our stakeholders to really understand a little bit more about the documents that we talk about as a matter of course in the government and how those documents fit together as we move forward to implement the Hearth Act regulations. So think of this as a little bit, for those folks who are maybe in my age group or older, a little bit of a schoolhouse rock on Government 101 and having to do with regulations for the Hearth Act. So first, we have the Hearth Act itself, which is a law that amends the McKinney-Vento Act. So this law or statute authorizes our programs. In other words, it provides the legal basis under which we must operate. This is not something that we can change. This is not something that we can waive. It is really up to Congress to make changes to the Hearth Act if changes are appropriate. So that is the general basis of everything that we're doing going forward. It's the law. It is posted up on the Homelessness Resource Exchange at www.hudhre.info if you all want to read it. So the second thing that we really have to consider as we're rolling out the Hearth Act programs is our annual appropriation. The annual appropriation is also a law passed by Congress that funds the activities that are authorized under the Hearth Act. It may also include additional legal requirements that we have to comply with. So for example, For many years now, our appropriation has included a requirement that 30% of our funds must be spent on permanent supportive housing. It is a legal requirement. It was not in our original statute. It is now incorporated into the Hearth Act statute. But it is something that is important for us to pay attention to and that we have to comply with as we move forward. I think the reason I raise this in particular is that in these tight fiscal times, it is important for us to understand and for you to understand what exactly is in our appropriation. It might provide direction on how much funding we're spending on specific types of activities or different types of programs. Specifically, it will probably tell us how much money we can spend on the Emergency Solutions Grants Program or on the rural program. So again, that's important for us to pay attention to. So the third thing that we have to pay attention to is the actual regulations. That's drafted by the regulators, in this case, us, the regulators, HUD in particular, that really further defines and operationalizes the law itself. So for example, the law provides us with direction that rehousing services are eligible under the new Continuum of Care program. The regulation takes that language and further defines what rehousing activities look like and what they mean in terms of budget requests and that sort of thing. So again, we're starting with the statute itself. It gets further potentially defined by the appropriation. And now we're further narrowing and defining what's in the statute through the regulations. And as you all know, we have 6 sets of regulations that implement the Hearth Act. So the fourth thing that you all are very aware of, I'm sure, is the annual NOFA. And that NOFA contains our policy priorities for the year, and it allows us to further sometimes narrow or define parts of the regulation. Here's an example. The regulation may allow for, and the law may allow for, a bonus to be funded. In this particular case, it does. The statute is clear that a bonus could be funded in any given year. The regulations reflect that requirement. Then we have to take into account the appropriation and see whether we have funding available to do a bonus. So the NOFA itself, while the regulation allows for this to happen, the NOFA itself will tell you whether we have the funds for a bonus, how much will be allotted to the bonus, and which populations may be served or prioritized through the bonus. So again, we're sort of working through this funnel and getting down to what's in the NOFA that will really impact what you can apply for in any given year. And then finally, we have guidance. The guidance that you're probably most familiar with is the Supportive Housing Program Desk Guide. It takes all of the legal documents that we work on all the time and provides practical advice, examples, context in non-legal English terms on how our projects should actually be operating. So the kinds of things that we consider guidance are desk guides, training materials, fact sheets, and other types of things that we generally post on the Homelessness Resource Exchange. So hopefully that's given you an overview of all the different things that we're sort of sorting through and trying to get out as additional information for you all on the implementation of the Hearth Act. So now that you understand a little better on how all of those documents that we have work together, let's go through some of the specifics. In early March, depending on the listserv that you might be on between the 5th and the 7th, I sent out an email to stakeholders that provided information on how we plan to proceed for the rest of the year. If you haven't read it, I would encourage you to do so. It can be found on the Homelessness Resource Exchange in the listserv archive area. So you'll see that the chart outlines the status of the 6 regulations we're developing as part of the Hearth Act implementation. The chart walks through, right now we have out as a proposed regulation, which means that it is not yet in effect, is the Homeless Management Information Systems, or HMIS regulation. The comment period has closed on that, so we are in the process of reviewing public comment and developing a final rule on that. As an interim regulation right now, which means it is in effect, we have out the Emergency Solutions Grants Program with the conforming amendments to the Consolidated Plan for ESG grantees. That took effect on January 4th, and it applies starting with the second allocation of the 2011 Emergency Solutions Grants Program. So in 2011, we did an initial allocation under the old ESG rules, and we did an additional $90 million allocation towards the end of the year that really followed the new ESG rules. The 2012 allocation has also been released. That follows the new ESG rules, as will every allocation moving forward. In final status, we have the definition of homeless, which I think both Brian and April mentioned in their part of the presentation. That means that effective January 4th, the new definition of homeless applies to the ESG allocations under the new Emergency Solutions Grants Program, as well as to the 2011 awards made under the competition. I'll talk about that in a moment. And then the last two that you see up here, the Continuum of Care Program and the Rural Housing Stability Program, those are going through the interdepartmental clearance process, which is managed through the Office of Management and Budget right now, and we do expect that they will be released shortly. That status has not changed since the March email. So I want to take a moment to pause here and acknowledge the fact that we have, I'm sure, lots of anxiety out there at the local level and worry about how you will implement all of these changes that are coming forward. So I want to provide some level of assurance in a couple of different ways. First is the SNAP's office has developed a rollout and training schedule that incorporates both the release of the regulations and the opening of the competition. That schedule will include broadcasts in which we explain how the regulations themselves will tie into the 2012 competition, and we will allow some time in between those, the release of certain documents and the broadcasts, to allow you to digest some of this information at the local level. The other thing I think is important for folks to understand is that to the best of our ability, we are leaving as much consistency as possible between the old programs and the new programs. So in other words, much of the information that we request from you in the Continuum of Care application and in the project applications will be the same. It will be familiar to you. The new Hearth Act programs are based in very large part on the supportive housing program and the Shelter Plus Care program. So a lot of things have not changed. The overarching concepts are also similar, even if labels may have changed due to the new regulations. And let me just give you an example. We spent a lot of time today talking about hold harmless need and what that means. So your hold harmless need amount now, based on what Brian was telling you earlier, is the amount of the cost related to funding all of your renewals for 1 year that are eligible in that year's competition. That currently incorporates just the supportive housing program. The new term that we're going to use will be renewal demand, and the concept itself is exactly the same. It is the cost of renewing all eligible projects for 1 year. However, the details are slightly different because we now include, based on the law and based on the regulation, projects that were formerly Shelter Plus Care projects in this calculation. So continuums will have the ability to look at across the board all of their projects that are now funded under the Continuum of Care program, rather than sort of piecemeal looking at their Shelter Plus Care projects versus their supportive housing program projects. Another example of a change with a very similar overarching idea is reallocation. Reallocation is now eligible by law. We had always done it really based on the NOFA, but it is now incorporated into the law and into the regulations. However, it will be different this year in that it is not limited to projects that were originally funded as supportive housing program projects, because the law allows us to expand that to include the entire portfolio for the continuum of care, including what used to be Shelter Plus Care and what used to be SHP. So for the competition itself, we understand that our communities do a lot of work around the competition, and how I used to actually write the application for the continuum of care that I worked in, so I know how much work it is and how difficult it is at the local level. So I do want to assure you that we are working hard to make sure that when it opens, when the competition opens, we have training and materials in place and ready for your use at that point, and there will not be a lag time. At least we don't plan on a lag time. Again, we plan to roll out the regulations and the NOFA in a specific order with supplemental broadcasts and materials in between to try and make this transition as smooth as possible. So now that you understand our plans in a little bit more detail, I want to touch upon some of the questions that we've been receiving through the help desk. And I specifically want to talk about the homeless definition that both Brian and April mentioned in their presentations. Again, the homeless definition is a final rule. It had gone through the public comment process and it went into effect on January 4th, 2012. It applies to the new Emergency Solutions Grants Program, again, starting with the second allocation of 2011 funds. It applies to the new Supportive Housing Program and Shelter Plus Care grants, new and renewal grants that were funded in the 2011 competition, and this is important, at the point where you execute your new grant agreement. So let's walk through that for a moment. If your 2010 grant, if your renewal and your 2010 grant expires at the end of April and your new grant funded under the 2011 competition begins on May 1st, the new homeless definition regulations will be attached to your new grant agreement. So that is when it starts to apply to you, on May 1st. But to sort of circle back to where I started this conversation, which was how the law sort of gets refined through the various mechanisms that we have, I want to talk about a couple of things here. The new definition does not negate the additional limitations on permanent supportive housing projects that were established through the 2011 NOFA. So again, the new definition is part of the regulation. The NOFA took that information and further narrowed it, and permanent supportive housing projects, that is SHP, PH, and all Shelter Plus Care projects, are limited as per the NOFA to serve people coming from the streets, shelters, safe havens, or from transitional housing if they were coming from those other places originally. The definition itself does not apply to the SRO mod rehab program. That program itself was not reauthorized under the HEARTH Act, although all of the eligible activities that are funded as part of the SRO program are eligible under the new Continuum of Care program. So please rest assured, for all of you that have SRO grants out there, that those projects that were originally funded as SRO projects will continue to be renewed through the same process that we currently have for those projects. Just the new homeless definition does not apply to them. So again, I want to talk a little bit about flat funding and what that means. I would encourage you, again, to go back and take a look at the listserv message that went out at the very beginning of March under my signature to see some of the details here. But you know, to manage expectations, we did get flat funding in FY 2012 at $1.901 billion. That is going to, it will necessitate the fact that things will be tighter in the 2012 competition, in part because there are costs related to implementation of the HEARTH Act. For example, whether we can do continuum of care planning dollars, which the law allows at up to 3%. The NOFA will explain in detail whether we can fund that and at what amount we can fund those kinds of activities. So I think it's important for you all to monitor closely the kinds of information that we're putting out in the registration notice and in the NOFA. So you'll get an idea of exactly what we think we have the funding to do in this year, especially as related to the Hearth Act activities and a bonus, and the possibility of funding a bonus. We monitor renewal demand very closely, so we think that we have a good idea of what we can do going forward. And again, I laid that out in some detail in the March email. I also want to review with you what you all can be doing to get ready for Hearth implementation and the 2012 competition. I think it's important that while we're here at HUD working through the documents and the training materials that you're going to be using locally, it's important for you to do some homework as well. And the first thing I would encourage you all to do is to look at performance and compliance. Performance and compliance are significant parts, especially performance is a very significant part of the Hearth Act. It actually requires us to look at performance in a different way than we ever have before. So now is the time at the continuum of care level for you to start looking at your current portfolio of supportive housing program and shelter plus care projects and look and see whether they're performing the way that you want them to. I would also encourage you to ask them if they're giving money back at the end of the grant term, because that is an indication of potentially weak performance. If there is a grantee or a project that is continuously giving money back year after year, that is not something that is looked on favorably by HUD, and you should, start looking at strategies to work on that at the local level. I would also ask you to start looking at partnerships within your community that maybe you haven't strengthened as much as you'd like to. Maybe you could start working more with your Department of Education homeless liaisons. Maybe your public housing authority could come to the table and help do some planning and potentially put resources on the table. So again, that's something that you can look at moving forward. Up on the slide, you see that we really do want folks to look at reallocation as an option. This goes back to our conversation about performance and funding. So if you have programs that maybe are not performing well, this is an opportunity to tweak those program designs or to change something from what is currently a very intensive transitional housing program that really should be a permanent housing program. So look at reallocation as a viable option. I think that Brian mentioned that we only had 39 projects across the country reallocated in the 2011 competition. And we really think that there's projects out there that if you can have a good, solid conversation about performance and expectations at the community level, that you might want to look at. We also, of course, recognize that the Homelessness Prevention and Rapid Rehousing Program funded by the Recovery Act is ending at the end of this fiscal year. So we want you to look comprehensively on where you can fill gaps that will be left behind by the end of that particular program. We also want you to look at how you can improve your data. And I think homeless management information systems and data collection, you can see that was really a weak part in terms of the number of points or the average points that communities were getting in April's presentation. That's something you really need to start working on and looking at, because data collection and data validity is going to be increasingly important as we implement the Hearth Act requirements. And those, again, are statutory requirements that cannot be changed or waived. So all of those pieces are going to become increasingly important. So I would just encourage you, again, if you have not already done so, read the regulations that are out there for you to take a look at. Please read the regulations and look at the materials we have on the Homelessness Resource Exchange before you submit questions to the help desk. I think that it's important for our stakeholders to understand that when we get a lot of questions on the help desk that are really quite easily, the answers are quite easily found in the regulatory text or in some of the materials that we've put out. It clogs up the help desk, and it allows us, or it makes us be less timely in our responses to the really important questions on policy issues that we want to make sure that we answer. I also just, again, want to say we are working to make this as painless as possible. It is not going to be a fully painless process to move from the old rules to the new rules. But again, I think that if you do some homework up front and work on the things that we're asking you to work on, you'll be in pretty good shape for the 2012 competition, especially if you pay attention to the rules and the broadcasts that will be rolling out, again, in a specific order with time in between over the course of the spring and the summer. And I guess the last, but certainly not the least thing that I want to do in today's broadcast is thank all of you so much for the work that you're doing out in the communities. Progress that we make nationally on preventing and ending homelessness is a direct reflection of the work that you all do every day. And I know on behalf of the leadership here at HUD and the people who are in my office, we understand and acknowledge that all the time. So I want you to know that we appreciate your commitment and your good work, and that we will work with you to try and make the Hearth Act implementation the best that we absolutely can. So thanks again for all of your participation today and for spending an hour and 10 minutes with us talking about the 2011 competition.